Hi, my name's Simon von Solden and I'm the CEO of Healthy Male and your host for today's webinar, Supporting Fathers at the Grassroots. Welcome to the fourth in our series of the Plus-Paternal Conversations. Now, before we get started, I'd like to acknowledge the traditional custodians of the various lands on which we work today and the Aboriginal and Torres Strait Islander people participating in this webinar. I pay my respects to elders past, present and emerging, and recognise and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters. Now, you'll see a poll pop up on your screen about now, and for those of you who have tuned in previous webinars, it's similar, but even if you filled it in before, please let us know of your area of interest for today's webinar. It's really good information for us. So, as I said, this is the fourth webinar in our 5-part series. The series is recorded, so for those joining us today, you'll get an email advising you of when it's available on the Plus-Paternal webpage and the Healthy Male YouTube channel. You're welcome to share that information amongst any of your networks too. We've tried to create an engaging program and hope that this will be a great conversation, which I'm pretty sure it will be, having had a bit of a chat to the participants prior. And you'll get a great opportunity to have your say as well. Now, a bit of housekeeping on how you have your say. So the chat function is available for questions to the panelists. And unless you've changed your settings, it's probably going to be at the bottom of your screen. So you can ask questions as we progress using the chat function. And your questions are only going to be visible to the panelists. So ask away and don't be shy. No one has been to date, by the way, so I think that you'll be fine. Now, there's also going to be a survey at the end of the webinar. It's not just for the usual feedback, you know, did you like us, didn't you like us? It's actually your opportunity to tell us what you think is the priority as we press for change. We really need to hear from you. So I encourage you to have a look at the rest of our webinar recordings on our YouTube channel and register for the final webinar on November the 4th, which is focusing on social and mental health. The link for registration is going to be provided in a follow-up email and it'll also appear in the chat. Now, something I also like to share is just to say that Plus-Paternal is not about taking anything away from mothers and babies. It's actually about adding to it. And that's why the people that we have joining us today are actually really good at adding the focus that we need to get this conversation progressing and get things started. So we're fortunate enough to have Helen Storer, Tom Docking and Debbie Spink with us. Now, I'll just stop sharing that screen. And sorry, on that, my computer has decided to do something very strange, so just bear with me a minute. I'll give you some background on Helen Storer. Now, Helen is a Plus-Paternal Advisory Group member, Australian Practice Nurse Association Board member, parent and child health nurse, midwife and practice manager. Helen's been working with the dual role of practice manager and practice nurse for more than 30 years in general practices and group practices across rural and urban Australia. During her career, she's completed the Community and Child Health Diploma and is a registered midwife. Helen's also been part of the Plus-Paternal Advisory Group for the past 12 months. Thanks for coming along, Helen. Just give us a wave. Tom Docking, he's going to be the easy one to pick. Is CEO and founder of Dad's Group and the founder of Father's Day event, Man with a Pram. Dad's Groups hold over 200 events across the country every year and collaborates with Australia's leading family support organisations to deliver strategic solutions regarding the isolation that occurs amongst new fathers. Tom also founded Father's Day event, Man with a Pram, which is an event where new fathers all across Australia can join together with their children and families to be connected and celebrated by their local community. Thanks for joining us, Tom.
Thanks, Simon.
And Debbie Spink. Now, Debbie is a perinatal peer educator and mentor, quite a mouthful, She's involved in the Dads and Peers project with Tom Docking and the Dads Group, and is a mental health first aid trainer. So for the last 10 years, Debbie's been a consumer representative working at a national, state and local level, advocating for system change with a particular focus on the perinatal period. Debbie has extensive experience in facilitating a unique antenatal education class titled Emotional Preparation for Parenthood and facilitating weekly perinatal peer support groups. The contributions led to the establishment and ongoing involvement in government-funded projects in Brisbane, focusing on improving mental health outcomes for families. And today, Debbie shares her experience in engaging fathers and prospective fathers in the important role of peer support and consumer engagement. Thank you all, and we've got about 45 odd minutes to see how much we can tease out on this topic. So I'd like to get started actually by asking you a question, Tom, which is, we talk about supporting dads at the grassroots, but where do you think the support should start?
Thanks, Simon. Firstly, before I answer the question, I just wanted to just say how excited I am to be part of this panel, and also be excited to be part of the work that you guys are doing, because we've been in this space for 7 odd years, connecting fathers. But until now, no one's really pulled together the underlying research for what we've had, our gut feel around what needs to be there. So thank you for that. And now to the question. The question being, when should we engage fathers or start, connecting with fathers around that, around educating them? And I think it's a difficult one, because you could say maybe it's in the hospital, maybe it's before the hospital, maybe it's when they get their first pregnancy test, an exciting time for some of them if they get to be part of that conversation. But really, I think I would go back before that, and I would start the education process when they're infants. It sounds a bit strange, but Dads Group connect dads with their infants, and that education of father connecting with baby, and the experience of that. And we all know experiential education is something that connects with us at our, psychological and emotional state. And so I'd probably argue that it starts when they're infants. So I'm not sure whether that's going outside the scope of the question, but yeah, I think it's probably my opinion.
No, look, it's actually, it's interesting as much that it's come up in our other webinars that there needs to be more done in the education of boys around the rest of their journey. I mean, we started this project looking at preconception, and thought we were a bit odd in looking at preconception as the starting point, because, you haven't even actually achieved anything yet. But the health of your offspring starts at that point. But even before then, you should be thinking about the whole journey. So, Debbie, how do you find it once they actually engage in the hospital system? Are you finding that you're having to start with pretty raw product, as we will call it, in terms of fathers or wannabe fathers? What's it like once they get there?
Thanks, Simon. And yes, I'd like to concur with Tom. I'm really, really pleased and grateful to be here. So thank you for the invitation. So I've been involved in antenatal education at a particular hospital in Brisbane, Redcliffe Hospital, for probably 8 or 9 years, but really much more intensely over the last 5 years. And I would say that attendance-wise, there's rarely an expecting mum that doesn't arrive with her partner, the dad or partner. So dads already who are very engaged to arrive at the antenatal classes. So that's fantastic. But in particular, my experience is that the way we run our emotional preparation for parenthood class, by co-facilitating with a peer educator, in this case, which is myself, is that what we're doing is we're trying to create that environment, that learning environment where it's parent talking to parent, as opposed to the inherent hierarchy that can exist between a health professional and expecting family. So we create this environment using language and a really interactive session to get dads engaged. And it has been my experience that dads are incredibly engaged in our conversations. I've probably facilitated more than 2,500 couples. So it's quite a large group. And invariably, I find it's the dads that ask the most questions, that respond to the most questions we pose, and also come up at the end of the class and are incredibly grateful for that. And I'll give you just a little example. Not too long ago, earlier this year, a couple in one of the classes, dad was from Papua New Guinea and mum was from here in Australia. And at the end of the class, dad came up to me and he just said, "Thank you so much for this class." He said, "I had no idea I was as important as mum in this whole thing." And he said, "All I kept thinking about during the session is all those dads back in Papua New Guinea and how we need to get this class back over to them so they know how important they are." So it was really wonderful feedback.
Yeah. And that's actually, and that really resonates with something one of our audiences said, that, we speak about pregnancy as it relates to women, but it's not just about women becoming mothers. It's about both partners becoming parents. And Helen, is this what you see? Like being at a practice level in terms of, and for those of you watching us, I mean, being a practice nurse means that you're at a general practice. So how often do you see men come in for the checkups? Are they there? Do they come at preconception? What's happening there?
Look, I don't think they actively, come and say, "Oh, I'm planning a family," but I think we're trying to change that conversation when we're, as a nurse, doing their weight and their height or their blood pressure before they see the doctor. We're trying to ask the questions like, doing an STI check, saying, "Have had you had a new sex partner? Are you planning to become a parent in the next, few years?" And from then, that sort of gives us a bit of an opening to do a little bit of education. And I find blokes like a bit of a takeaway. They don't want to talk about things so much. But if you can flick them an email and with some information, or give them a brochure, they're happy to take that and come back to you, next visit, or if they have specific questions.
Right. So when we look at engaging fathers or wannabe fathers, or we need to start to get to the grassroots of it, do you think it is best placed that we look at education as one part? Is it then we educate a boy through his relationship with his father, and then we look at, what happens through the health system? Or where does it start? Tom, probably in terms of how are you seeing, being 7 years into running Dad's Group, how are you seeing the relationships change, I suppose, with dads and their kids?
Yeah, that's a great question, Simon. I might just start by saying a really intelligent advisory board member, Brad Kearns, was talking to us the other day, and he's got the smarts in the marketing space, very, very sharp. And one of the things he said to us about this particular question around when should you engage with fathers was that when you're in the hospital suite, it should be about the 12th time when they see a poster saying, join a Dad's Group or get involved in a father support program, should be about the 12th time they see something of that nature, not the first time. And this really highlights what we're talking about here. How do we essentially push people on that journey? Marketing seemed to have nailed it. Take away from the health promotional space, look at marketing and how they sell stuff. They work out when do users want to connect, when will they actually make a commitment or a purchase, so to speak. In the concept of health services, the purchase may be joining a program, it might be doing an activity, so to speak. So I think it's important to realise that we need to have a strategy for the entire journey of a human, and work out which touch points and nudge points are we going to continually build that base of education. And when I say infants, I'm obviously not saying we should run a class, for instance, around why they should be good fathers. I'm saying just by them connecting with their fathers in Dad's Group is an emotional learning experience for them. So by the time you say before, the boy connects with his father or a young girl connects with their father, when you talk to them and show them and role model these things, by the time they get to teenagers and have discussions in schools about fathering and how, if they want to be a father and how they want a father and all those types of things, then it's come from a baseline of experience of role modeling. And that's really where we think is a big gap in our culture. The culture of fatherhood has an opportunity now to change, and we're excited to be working to change that culture, and also realise that we've only played a very small part in that piece, and each different organisation, whether it be a youth health organisation, whether it be a men's health organisation, a mental health or a family psychology base, or a GP, they all have a small nudge to make along that journey. I think if we have a holistic approach, then we can say no one single person or organisation or particular entity's responsibility. It's all of our responsibility, in the same way we've changed culturally with other major things around respect for women, etc.
So we need a system change.
We do.
Yep. So Debbie, you wanted to add something to this?
Yes, Simon, I definitely did. So for me, over the last 10 years and being involved in the system, an observation I've made is I feel as though becoming a family, having a baby has become a health experience. Whereas to me, it's a life experience of which the health system contributes. And I think that perhaps we've lost that lens through which we view becoming a family. This is a life experience. This is a community social experience. So for me, I think that we need to view it that way, in that the health system needs to contribute to linking in with proper, well-organised social and community services, because I think you'll find that for dads, and this does include mums, because I certainly engage with mums too, but we can often support or intervene or prevent escalation of challenges that exist within a family simply by connecting them with their peers, done in a safe, non-judgmental way. We can prevent, I think, so many experiences of families that are challenging, escalating, and end up having to utilise services within the health system, if we can just improve how we can connect families with other families. So I guess I come from a very community-based social model of thinking with regards to having a family, not purely just the health lens, but just the way having a baby has evolved. It's really become a health experience, and I think we need to go back a bit and think a bit more broadly.
Great. And Helen, from a practice perspective, what's your take?
Yeah, I think it's a bit of a, whole team approach. It's from, the front of house asking, someone who's bringing their child in for vaccinations, do you want an appointment at a time when your partner can attend, to make it more inclusive. And I would agree, Simon, it's just a gradual change. It's going from calling them, antenatal classes, perhaps to parenting classes. Our local maternity hospital, their parenting classes, you can, if you're a FIFO worker, which in WA, and I'm sure in Queensland's a really big thing, they can actually dial in and attend from the mine site, so that they are actually included in that journey. So I think we are making small changes, but we've got to keep going to include fathers.
Yeah.
Yeah.
So on that, our survey showed that 61% of health professionals thought that actually the health system wasn't doing a good job with fathers. And 43% of fathers actually had a negative experience with the health system. In fact, someone said to me, and I think it might have been you, Tom, so I'll dob you in for it anyway, but was surprised that actually the number was 43%, in as much that was it a case of they went into it just not knowing what it should be, and so thought it was okay still, whereas it really wasn't geared towards them in the general sense. So I suppose what I'm getting around to is, if that's the feeling, if that's the general feeling that's there, both with health professionals and with fathers that have gone through the system, how do we reach men in the community who actually might not be engaged currently, so they don't actually know that this should be happening? they don't expect anything different. And so where do you start? I will direct it at one of you.
And I think I'm going to understand the question by saying, what about those who actually don't have access or haven't been? So how are we reaching those, particular people who might benefit most from the program but have no understanding or access to it? And this is such an exciting question for me because working with Richard Fletcher, as we all know, if you're in the fatherhood space, is I kind of call him the father of fatherhood research in Australia, and he's an amazing leader and pioneer in this work. But his program SMS for Dads is a way that we're combining our programs, which are face-to-face engagements with fathers, with a program that allows more reach. And you're asking, we're just launching an exciting new program with Queensland Department of Communities up through Rockhampton, Townsville, Toowoomba, and some of those more regional areas of Australia. And by partnering and working with Richard and the SMS for Dads team, our reach to support new fathers in various different ways is going a lot further. So in answer to your question, it's about going back to what Helen was talking about and what Debbie was talking about, those 2 points being you're first a human and you're having a human experience. And then secondly, we need to understand what your experience looks like to actually engage you at the right time. And so in looking at that user-centered design piece, we go, there is a father and he's a farmer and he is isolated. There is a father, he's in the city and he's geographically not isolated, but emotionally isolated. And we say, well, both of these can benefit from a face-to-face program, but the one who is geographically isolated is going to struggle to get there. So how do we actually create a pathway of access to these isolated, geographically speaking, fathers? And we use technology to bridge that gap. And this is why, I always say this season is a really exciting season to become a new father, because we're pushing the boundaries and we're implementing innovations using technology to actually change that piece that Debbie was talking about. And that is that emotional core of a human that says, I want to feel connected. I want to be part of something and I want some support, but I won't look for support because that hasn't been a behaviour norm for my culture.
So the digitalisation of everything has actually opened up the grassroots?
Yeah, the digitalisation can help. It can absolutely hinder the process as well. So it's like anything really. You can take a cup half full or a cup half empty approach to it, and you can leverage the opportunity that it is, or you can let it fester and become something that really isolates people more. I mean, we all know examples where, the digital worlds have made us feel isolated. And we've also probably experienced times when we've been isolated, the digital world has been able to bring us together. So it's not, is it good or is it bad? It's more about how can we use it to achieve those human outcomes that we really want to push, those things around connectedness, confidence, competence in parents, particularly in this discussion, fathers, and how do we get them to feel like that? Because if they feel confident and competent, they're by nature going to be more excited about their role as fathers. They're going to be more supportive to their partners, wives, and the other caregivers, and they're going to enjoy and see the opportunity in fathering rather than the laborious, heavy challenges, which it is. But it's also we can lose ourselves in those challenges without normalizing that experience with other fathers.
Yeah. And look, there's a basic rule with these webinars. I forgot to mention, if you mention someone else's name 3 times, they get the next right to reply. So Debbie, it's over to you.
Thanks, Simon. I think importantly, across the maternity service system is we need to do it in a way where families have more choice. I think this is a serious lack of choice. The system has somewhat been designed, and this is not just dads, but this will come from mums too, is they feel like they're told what they have to do every step of the way, and there's not a lot of choice. And if we want to engage fathers better, I think we need to give the family choice. So I know in your previous webinar talking about systems and policy, how we can change it, and the client is the mother here in Queensland, but can the client not be the family? And then the family chooses who is in their family. And those 2 members of that family and then the baby, that's the choice of that family. And then each member of that family has equal power in that system about what happens. And I think that's a great way to help dads to feel more empowered for a start. So that's a big change. But language is just a simple way to better engage dads, and it's actually really not that hard. You know, I think there's perhaps a concern that how on earth are we going to do this better, because perhaps people haven't, you know, the system hasn't been designed to enable it. But in fact, it's actually not that hard. You know, words here, words there, or even just a mindset shift actually can be where it fits. If the system has just a little mindset shift, the language can come more naturally. That makes dads feel more included. So yeah.
Yeah, and you're right, Debbie. That actually did come through in the last one. Actually, just even the language shift. So the support services that are needed for men, do you see them as being vastly different to what they are today? Or is it that we have support services in place that need to be altered to include fathers? So are we talking about renovating what's there, or actually do we need to create some space for men as dads in their own right, or is it a combination thereof, and you know we need something else? Helen, I'm going to start with you, because at a practice level I know the challenge of trying to include the dad when he's not the client is a challenge. But then, so how do you integrate that into your mechanisms?
Yeah, I think it is just a slow change that we need to make. You know, we're very good at doing the 6-week postnatal check with the mum and doing the baby's vaccinations at sort of 6 to 8 weeks. But I think we really need to, perhaps rebrand it as a family check, and use the team, use the nurse to talk to the father and say, how are you doing? I mean, we do depression checks on the women, but we don't actively do anything for the men, and I think that's really something we need to work on. And I think it's just a slow system change, using the whole team right from, like I said before, front of house, just making the appropriate booking and then getting the nurse involved, and trying making it, a whole family checkup. And it can be even, I try really hard to, when I get that birth notification, to contact our families and say that those appointments are available. Telehealth has been helpful in that, people are more accepting of a phone call, particularly from the nurse, to say, well, actually, come in, we can make a time after work hours to go through some things. But I do think it's just a gradual, we're not going to change it overnight, but I think it's changing some of the terminology. We've got some good systems in place, but it's just expanding them to be not just a 6-week check for the mum and a 6-week check for the baby.
Yep.
I think if I could add to that, I completely agree with what Helen's saying there, and also what Debbie's saying. It's actually not too difficult. It's not an insurmountable problem. It's actually something that we can address. And Helen was talking about that change in how, the midwives. My mum's a midwife, so I'm particularly passionate about this. And already the midwives and the antenatal class facilitators are doing generally a great job here. Typically, they're under-resourced. They're pushing hard to be able to get the actual content to the mums that need to be done. So they're already stretched to get to the mums. They really want to get to the dads, is the general kind of understanding from all my research in the last 7 years of interviews with midwives. So they want to help the fathers, but they're not resourced to. And you ask Simon, do we need to modify the current systems of support? I would say ask the dads what the current system of support is, and you'd get a lot of blank faces. So the dads probably don't know that there are any. And that really reflects that if they don't know that there are any, there aren't any effectively, because if they don't know that they're there, then they're not there, or they may effectively not be there. So there is a piece around changing the listing but it's not, as Debbie said, it's not actually too hard to do. And this is probably a good time to highlight that with Debbie and Helen Funk, and a few people are actually participants on this call, we're doing some really exciting work in that space. We're implementing some of these things as a trial. And, you know, you were talking, Helen, about that screening for mums. We will, in only a few weeks, we'll be screening the dads as well through this process, which is really exciting. And that will be something that we'll review and identify if that works well. And to answer that question, so on what needs to happen, we'll be able to come back hopefully in 3 to 6 months with some really solid outcomes and some evidence and some feedback from participants of those new interventions, those new fathers and interventions, and identify which of them are most effective around access, around, you know, the changing of the current process, the education, if there needs to be for any for midwives around engaging fathers, and the programs that fathers can access in the hospital space or universally prior to or during or after.
So actually, and Tom, you have quite beautifully, I think, actually almost answered the question that we've had posted. So the question is just asks, in private hospitals, including many residential early parenting services, the costs are only covered for women and infants. Do you have any guidance on how we could persuade the private health insurers to allow these services to claim for screening and referring fathers? Now, what I took out of what you said, though, is that, well, don't we first have to offer the service?
Yeah, that's true. And hello, Karen, and great question there. I think there's a number of different, the way I see this is it's a bit of a chicken or the egg scenario with who gets to what first. But with the private hospitals, you know, there's already conversations that are beginning with us and a number of other organisations. I know that Steve Kennedy, he's doing an amazing program for birthing dads that really goes into the depth of how to support new fathers in that space. But there are already those conversations happening at a pilot program for a number of different hospitals. How should it happen? I wouldn't be qualified to say how it should happen, but I think we will see the evolution of these programs implemented into private hospital spaces and public hospitals. From our organisational perspective as a non-for-profit organisation funded by state governments, federal governments, Movember and other types of organisations doing research in this space, our disposition on this is to provide free programs. That's our utmost priority. But also with the knowledge that to get there, in some instances, we will pilot a fee for service which would be happily paid by an insurance provider or a private hospital to give that experience to the fathers. But the father putting the hand in their pocket to pull out a wallet to pay for a program is absolutely not what we are aiming to do, but we do value those programs in the scheme of things, because we're going for more of a universal approach, but we're wanting to plug in other programs like that Steve Kennedy's doing to be able to enable those, you know, the opportunity for people to go deeper, to invest in their own educational spaces, which I think is absolutely important. And so as an organisation, we see ourselves as that aggregator of support for fathers programs, and we're working with a number of different organisations in that space, so that, you know, as you said, what do we need to do here? Well, hopefully in 6 months, most of the fathers in Queensland will have a short little a la carte menu of going, okay, do I want that? Don't I want that? That's free, that costs, that's free, okay. And then they'll have a conversation with their partner and they'll say, I'm going to do this. And that's one step towards being a better father, a better partner, and the outcomes that we're all, you know, really trying to drive home, which is a safer, happier, more connected little family unit as they bring life into the world.
So we've had a question posed. I'm just going to slightly reframe it. But so how does the system manage where it's two dads or it's just one dad at the moment? Like, there's obviously it's would struggle, I would guess. I'm not sure if Helen or Debbie, you're best placed to answer this one. Neither of you is rushing to turn your microphone off mute. Helen, if you're going to answer me, I just
I'll look, we've had a couple of you know, same-sex parents who you know, we've supported. It's interesting for them, and I think we've still got to do some work in that. And look, you know, in an ideal world, I'd love that, you know, that families could have a choice about which one of the parents takes leave at what time from their job. You know, so, you know, the government would say, okay, you're entitled to 12 months. You two can sort it out amongst yourselves and work out who's going to take 2 months, who's going to take 4 months, who's going to take another 2 months. But, you know, that's an ideal world. That doesn't really happen. But we are making, you know, a few changes in that sphere. You know, it's a little bit more acceptable for fathers to take time off, not in all areas, but it's the same with you know, looking after them. You know, we found, you know, it just sometimes both of them came in for appointments. Sometimes, you know, one would turn up with the sick child, and I think it's that just slow changes. It's a bit like, you know, I've talked to the panel before about even you know, my daughter, who's an early childhood teacher, she alternates which parent she rings when the child's sick, and the fathers go, oh, you're ringing me, and she says, well, you're down as an emergency contact, shall I leave it with you to sort out what's going to happen? And I think it's just empowering fathers to have some control and some ownership, and we're not going to change the world overnight, but I think everyone's doing really good things about slowly changing. Yeah, and general practice from, you know, same-sex parents, I guess, you know, we're fairly inclusive. I guess it's a different question, and certainly during COVID times I've heard some terrible stories, but you know, parents who haven't been able to have even one support person in with them during delivery. So I guess we'll see a little bit of research around the impact of that. I don't know, Tom, whether you've heard much about that effect.
Yeah, we've been, well, we worked with Movember to quickly pivot when COVID hit to create an access all areas pass for dads to a program that runs daily for new fathers. So that's been really great. We were contacted by some organisations down in Victoria when there was that extreme isolation challenge going on, where fathers momentarily with either thought they couldn't or weren't able to access, you know, mum and bub during that birthing space. And so, you know, the question at the time from the media was, you know, is this the wrong thing to do? Is it horrible? And our response was, well, what can we quickly do to help the people who actually need help right away? And I think that's your approach as well, Helen. It's, you know, and with some of the diversity complexities, actually there's not many complexities at the coalface. They're just human people that you talk to and you work through what their needs are. And it's actually, from a health service perspective, we're all here to help the people who are in front of us. Like, that's our role. And so if you treat them as a human, and you ask them what their needs are and how we can help them, the answers kind of find themselves. I think at a policy level it gets complex because you're trying to include wording to categorize and all this type of stuff, which you know, we understand is required. But I really think from the midwives and nurses and the health practitioners at the grassroots level or at the coalface, there's less complexity there. I'm not saying the situations aren't complex. I'm just saying the ways in which they approach them from a human perspective it seems to be, you know, you're here to care and support this person, and you're working out how to do that. And it's not as complex and as difficult compared to when you're at a policy level trying to think of aggregating all these situations and how do we create a policy for that. So, you know, I'm not sure if that's helpful, but I think it's important to point out some of these core truths, like Debbie pointed out before. At that human level, it's important to note that's the core of what we're doing. And then a hospital or a health service, it's dealing with people who need help and support medically and otherwise. And so if we take it back to what it was founded for, what, you know, hospitals, you know, were set up for, I would argue that it gets simpler the closer you go to the coalface in terms of how to respond. it gets more complex the further away you go in trying to change policy. And that therein lies, Simon, I guess, some of the challenges when you're trying to change policy. You actually need a lot of cold-faced workers providing their inputs into the case studies to be able to work out how to write policy.
Yeah, and it is where the top-down, bottom-up approach is the only way you're actually going to achieve any sort of change. And look, I just want to, I suppose, touch on something that you've all mentioned. It's come up in our other webinars, and I want you all to have a crack at this. I suppose what I want to pose as a question, can we actually afford a generational or a change or a slow change when it comes to dads, the way that currently everything works for dads and their integration with their kids, their own children, and the way the system sort of works around them? Can we actually afford to have a slow or generational change? Debbie, you want to start off?
Excuse my dog barking in the background if you can hear him.
That's fine.
He was sleeping on the floor a moment ago. I would just say, can we afford not to? Really? Yeah, I feel really passionately about this. It's very hard to create change, but I think there is one time in our life where we very much have a captive audience, and that is when we're having a baby. So with regards to systems, there is during pregnancy and birth, the system must engage with those people. So we utilize our opportunity where we have this captive audience and we start to make change there. I kind of liken it to, as we know, like with mental health problems, trauma, there's an intergenerational cycle that occurs. And I feel like what we need to do is put a stick in the spokes of the wheel. And we've got to choose a point where we do have this captive audience. And I do think that, you know, the perinatal period is a chance to do that. So what we know is if we don't engage fathers better, the impacts are very, very clear. We know, you know, a leading cause of postnatal depression for women is the sense that they're in an unsupportive relationship. Now, I would clearly say to you that I don't believe partners are trying not to be supportive. I believe they're desperately trying to be supportive. However, support needed and support offered are missing each other. And this actually, we can make a big difference quite simply in that by empowering dads and giving them small little tools and language to use, and then we can create a better connection between mum and dad. And when we create a better connection between mum and dad, that impacts on the social and emotional development of babies. And so then we've created a next generation of babies who feel more secure in the world, have got healthy social and emotional development, and they're more likely to grow up to being better fathers and mothers in the next generation. So we can't afford not to, because, you know, our system is drowning in having to respond to acute crisis problems, whether it be mental health, whether it be employment, education, housing, justice, all of those social elements of our world. Our system is drowning in trying to support those at the pointy end. But what we want to try to do is prevent people ending up at that pointy end, don't we? I mean, we've got to do the early intervention prevention stuff if you know, we're going to survive. Otherwise, the pointy end is going to keep getting bigger and the system's just not going to cope. So
yeah.
We have to do it.
So effectively what you're talking about is this is a prevention strategy more so than anything else. Yep.
I can't say for sure whether it's absolutely prevention.
Say it, Debbie.
It is. It's prevention. It's early identification, early intervention if necessary, and prevention. And it's what Tom was saying. This is a human issue. I've often said I wish our system embraced humanity more and viewed it through a human lens, because that's what we all are, and perhaps less of a medical health lens, but more of a human lens. And I guess that's where what Dad's Group does, and what I believe really strongly in too, is peer support is a low-cost early intervention or prevention strategy that I think that we should absolutely invest in, because we're connecting humans together, and that's at the core of our well-being, is feeling connected.
Yep. Helen.
Yeah, look, I would agree with everything Debbie says, and you know, Tom mentioned earlier that we probably need to tackle fathering really early, and you know, I've spoken to a school nurse at a all boys school and said, well, do you talk about fatherhood? And she said, oh no, you know, like we haven't got time to talk about that. But I think we should be saying, you know, let's talk about, you know, fathering, what that looks like. I mean, the girls' schools get on board about, you know, mothering and send them home with the fake baby that keeps everybody awake for the whole weekend. And maybe the boys should be doing the same thing. They should actually, you know, have that experience and a conversation started. I mean, we know that, you know, 50% of year 10 boys and girls are sexually active. So, you know, there's going to be a few babies. And I think, you know, we need to work really hard at looking at how we can support our rural fathers, our Indigenous fathers, and certainly, you know, those other cold groups that are out there that don't get as much support. You know, I think quite often people who are, you know, educated, have got money, have got private insurance, do seek out more support and help. And we're leaving a lot of people behind. And, you know, I would agree, we need to tackle this from as many, you know, prongs as we can. And, it, you know, we can't afford to wait. We have to tackle every opportunity that we've got through, you know, fathers groups, through educating mothers to say, well, actually, you know, you need to include the father in, and you know, the grandparents need education, because the grandparents are quite often the ones that are helping with childcare. And you know, I've got some beautiful granddads here that, you know, drop kids off at school and walk babies around the block, and I think that's a really great thing. But we need to celebrate that sort of inclusive whole family, extended family. Yeah.
Yep. Tom?
I need the question again. I've got
So the basic, what I suppose I'm posing the question of, can we afford a slow or generational change?
Yeah, the way I remember listening to this, I was like, can we afford it as compared to a fast, expensive change? Well, we can't afford the fast implementation to radically implement programs. So can we afford a slow one? Can we, as Debbie said, we can't afford not to. And that's with the assumption that it's either slow or no intervention. So we can't afford not to. And then while we go back to it, what are we trying to change? Well, we're actually talking about all the elements of changing a culture. We're not just talking about changing a system. We're not just talking about changing a program. We're not just talking about adding new programs. We're talking about changing a culture of fatherhood. And to be able to do that requires the community's input. It requires grandma, grandpa, mother, father, uncle, auntie, all those pieces of a community. You know, it takes a village to raise a child. We say that, you know, all the time. It actually takes that village, and who is in the village, and how do we actually take them all on a journey? Because changing a culture, you can't do by implementing a program in a school, or you can't do it by implementing a program just for GPs. It's going back to that original point that, you know, our advisory panel member said, it's got to be, you know, in this case, it's got to be the 100th time that they see something that relates to fatherhood when the guy goes to a GP, or when the guy, you know, rocks up at the antenatal class. He's got to know deep down that there's need for this. At the moment, we're rocking up with like glazed eyes and blinkers on, not knowing really, we're in a foreign space of this medical smells and, you know, maternal spaces, and we feel uncomfortable and we feel like we're not we shouldn't be here, or it's not our space. And so to change that requires all these pieces. Yes, it's going to be slow. And when Kate and I started Dad's Group, you know, I just said, I'm going to make a 25-year commitment to this. I don't, you know, some years it'll be up, some years it'll be down, some years it'll just be running a local Dad's Group in a park. Other years we'll have funding from federal government to do great big programs. Last year we had the opportunity to run Man with the Pram nationally, and we had, this village that raises a child. I mean, you see the photos of these outback towns pushing prams with babies in it, but wheelbarrows with kids in it, and all different types of things. And over in Broome and Boolyah in Queensland and WA, there's a celebration element to it. So to answer your question, it will be a long, slow change, but we now have, the impetus for change, the underlying research. This sits on top also, as you guys would acknowledge, the research that has come before this as well. So we're developing, I guess what's exciting is we're developing not just more research, but we're starting to have the conversations. How do we translate that into proactive program changes on all these different levels? The next question down, I guess, which will be the complex one, is where do we start?
Yes, and that's probably for another day, because yet again, I've done a shocking job of timekeeping. But I'm going to give you one last question, and I'm going to get your answer really quickly. So for anyone watching, themselves personally and the organisations they're in, what can they do to start influencing change? Where can they start? Tom, your mic's on, you can start.
So where can you start? Well, I'm just going to post this in here, back to the dads group. We're implementing some of these changes we're talking about in pilot projects. It's really exciting. If you're a health practitioner, if you're a nurse, if you're a father-to-be, or if you're a father who's just particularly passionate about this, you're a mother and wanting to get your partner more involved, or if you're just someone who sees this and you want to contribute to this movement of supporting fathers in a new way, because your fatherhood experience, be it your father or be you as a father or you as a partner, is something that you're passionate about changing. We want to provide an opportunity for people to join our projects and work with us. We've got a huge amount of work to do in the next 12 to 18 months, implementing programs in hospitals, in communities across both Queensland and nationally. And so that link there, if you click on Get Involved, you'll be able to just register how you can get involved with some of the projects that Debbie and we're doing with Healthy Male as well. So we do want to provide that opportunity to join the team and join the movement, so to speak, because it's an exciting movement and there's lots happening in small little pilot projects.
Excellent, thank you. And I'll just get our fabulous people behind the scenes to pop, thank you, because Tom very cleverly sent that just to the panelists, his link then, and we know who he is and where he lives. Debbie, what can anyone watching, what can they do within their organisation or themselves personally to start influencing some change?
I just think, first of all, think about the language that you use and think about your mindset when you're communicating with expecting or new families. Just be aware that this is a family. This is not just mum, this is a family. So think about your language. But I would just encourage anybody, if you see an expecting or new dad, just ask them, how you going? Like, it's just start a conversation with dad so that he realises that he's important too, because most people, if you see a pregnant mum or a new mum, and the focus is all on mum and the baby. So we just encourage everybody to remember dad's there too. Have a conversation with dad. And that just tells him, oh, so I'm important too. So that's part of the culture shift, the culture change that we need to have. And as you know, that change, well, it is reliant on supply and demand, isn't it? So we need to also create the demand in order to change the system. So doing that on the grassroots level, letting every dad that we intersect with know that we think he's important, he's a critical part of this family unit, part of the parenting team, and we care about him. So that's the mindset.
Debbie, I have to say, across our 4 webinars so far, you're winning the answer to that question, I reckon.
Do I get a prize?
Yeah, we'll work that out later. We'll be in touch. Yeah. Helen, what about yourself?
Yeah, I think just empowering your team, right from front of house to ask the questions about the appointment. Do you want your partner to attend at a time that works for you, your family? Again, I agree wholeheartedly with what Debbie's saying, is changing our language, checking in with new dads, prospective dads, and just then using the nurses within your team to do that checking in, and then hopefully it'll trickle on through to the GPs to make time to get the dads back in to check how they're going.
Excellent. Thank you very much. And thank you to all of our panelists, Debbie, Tom and Helen. Yet again, I've enjoyed myself way too much. And to everyone that's tuned in today, thank you so much. Thanks for your questions. As you can see, achieving change is going to be a collective effort. And so if you haven't already viewed the case for change that Tom's held up, and he's a much better poster boy than me, but this one, please have a look at it on our website. Interested to hear about anyone who wants to formally endorse the case for change, which Dads Group have done, along with many, many others. So the webinar will be sent to you shortly with a link. Now, when the session closes, there's a brief feedback survey I mentioned before. Please fill it in because it just gives it a little bit of info. It's going to take you 10 seconds, seriously. So if you could just fill that in, that'd be great. I'd invite you to register for the final session, Social and Mental Health of Paternal Lens. If you haven't already done so, it's on Wednesday, the 4th of November at 12:30 Australian Eastern Time. Thanks for your participation and the contribution of everyone in making this event a success. And of course, with the AFL and NRL Grand Finals on this weekend, it would be totally remiss of me not to say that we hope the best team wins. Actually, that's ridiculous. I don't hope the best team wins at all. I hope go Storm and go Tigers. You can send all messages to, Healthy Male. Make sure you send them Monday though. You'll get very different responses depending on the outcome. Thank you all yet again. It's been an absolute pleasure. Please stay safe and look after one another. Thank you.